The coronavirus quarantine is a great chance to tap your musical talents. Or read a book, or bake a cake. But it's not fun and games for everyone. Lockdown can quickly become locked up for victims of domestic violence.
We know lockdowns and quarantines are essential to suppressing COVID-19, but they can trap women with abusive partners. Over the past weeks, as economic and social pressures and fear have grown, we have seen a horrifying global surge in domestic violence.
Calls to abuse hotlines and police departments are spiking around the globe. I'm Ben Fazoulan. When the crisis broke out, a policeman told me he was worried about a sudden rise in domestic violence. He was right. It's happening behind closed doors in homes around the world and was already a big issue in Lebanon.
She simply wanted to live a happy life with her 4 children again, without fear or pain. In mid-April, this 35-year-old mother left her old life and fled to an emergency shelter for women. Here, with her children, she's trying to process the pain she experienced. For more than 9 years, she was mistreated and abused by her husband and her father-in-law.
In the first few years, he used to hit me in the face, in the shoulder, or stomp on my legs. Later, he beat me with sticks and iron rods, so badly that I had severe swelling and intense pain. I developed problems with my bones and joints because he always hit me in the same places.
In Beirut, sexual abuse within the family is a widespread problem and often a taboo topic. Now the situation has gotten dramatically worse. Due to the coronavirus epidemic, Lebanon's government has introduced a nighttime curfew. Most shops and businesses are closed and people are expected to stay home. There, behind the facades, there have been some terrible scenes of domestic abuse.
It got increasingly worse. He became more and more violent, and he knew that I could not go to my parents. Because of the nightly curfew, everyone stays at home.
The COVID-19 pandemic came at a time when Lebanon was experiencing its worst financial crisis in decades. The currency is struggling, unemployment is on the rise, and wages have been cut in some cases up to 50%. Aid organizations say many men are bringing their frustration and anger home with them and taking it out on their wives.
Most women who get in contact with us are victims of domestic violence. The situation is getting worse because of the curfew and the economic and social pressure, especially because the perpetrators are always at home now.
That's why the Abad organization is stepping up its activities. They've hung banners throughout the city calling for an end to the violence and offering a hotline to get help. It's an attempt to encourage many women to break from their silence. And it's working. The group is getting more and more calls. So far this year, they've already received twice as many calls as in 2019.
Just in the last month, we had about 300 calls, 240 new cases. The others had already made contact with us, and more women want to come to our shelters.
This brave woman is one of them. She's refusing to take the abuse any longer and is now filing charges against her husband. A clear signal in a time of crisis.
The Europe head of the World Health Organization says the agency is deeply troubled by reports of increasing domestic violence and is sounding the alarm.
If lockdowns were to continue for 6 months, we would expect an extra 31 million cases of gender-based violence globally. Beyond the figures, only a fraction of cases is ever reported.
Only a fraction. That's deeply troubling. Junko Gupta joins us from George Mason University's College of Health and Human Services. A lot of us live in loving homes and can't imagine the fear and pain of abuse or being trapped with your abuser. Give me an idea of what that's like for these women.
Yes, it's very scary and isolating. And the figures that the WHO Europe, the sound bite that you just played, they're alarming, but they're certainly not very surprising for those of us who study the epidemiology of violence against women and those who provide services. We know from patterns following other crises, such as natural disasters or the Ebola epidemic, that violence against women does increase following these large-scale crises.
These figures are really incredible. I mean, the WHO is saying 60% of women just in Europe are affected. I mean, every second woman.
Right. And this is on the backdrop of violence against women, specifically intimate partner violence, which is violence that occurs within romantic relationships. Even before this coronavirus crisis, it was quite high. Global estimates from the WHO show that 1 in 3 women will report experiencing physical or sexual violence from a romantic partner at some point in her lifetime.
Let's return to Hans Kluge from the WHO for just one moment. Listen into this.
There are examples where countries have addressed this. Italy has an app to ask for help without a phone call. Pharmacists in Spain and France can be alerted through code words. Hotels in France and Belgium have been converted to shelters. Greenland has limited the sale of alcohol to make the home environment safer for children.
Let me explain that last point. Nearly a third of people in Greenland suffered sexual abuse in their childhood. This crisis is uncovering one horror after the next. How do you keep kids safe if their parents are the perpetrators?
Yes, it's very difficult for children as well because the people in their lives who would have been in a position to help, teachers, pediatricians, those types of things are all closed now. So I think one important thing to keep in mind, and this is true for both violence against women as well as violence against children, is that family and friends can continue to try to maintain connections. Just because we're physically distancing doesn't mean that we can't have a social connection. We can all try to become familiar with helplines that are operational either through phone or by text. We can all also develop code words with family members so that if somebody is in trouble, they can signal through a code word, just similar to the clip that you just played about the code words being used in some countries.
But is that it? Are they the only options, family and friends? I mean, what about people who don't have family and friends?
Right. So healthcare workers, obviously, they are overwhelmed at this point, but they can certainly become familiar with the risks of shelter in place and lockdown for both violence against women and children and refer to resources. Telehealth is being used more frequently for appointments, so exploring how telehealth can be used to make those referrals in a safe manner as well.
Junko Gupta, thank you very much for being on the show today.
Thank you.
Now to your questions on the coronavirus. Here's our science correspondent, Derek Williams.
What do you think will happen after lockdown? Is a second wave very likely?
Well, no one can predict the future. I mean, who would have predicted that we'd be here a couple of months ago? But a second wave is certainly possible. What's still up in the air is exactly what form it could take. In a great article I read this week, some top experts from the U.S. talked about what might happen next after mitigation measures are eased. Now, their models are based on data from past influenza pandemics. They hypothesized 3 different scenarios. In the first, the current spike in cases of COVID-19 would be followed by a series of repeating smaller waves every few months for the next couple of years, right into 2022. In their second scenario, we would see a fall this summer, but COVID-19 would come back with a vengeance this fall and winter. After that big spike in cases, there would be smaller spikes in 2021, with the pandemic only starting to peter out in late 2021. In the third scenario they postulate, which they called slow burn, there isn't a big second wave. That would mean we're going through the worst of things now, and depending on mitigation measures, the infection will remain with us in the future, but without a clear wave pattern. One way or the other, they say, we have to be prepared for at least another 2 years of significant COVID-19 activity.
If antibodies only work for a limited time, is there a risk a vaccine will only protect you for a limited time?
Yes, there is that risk, although antibodies are only one part of the immune response when you contract a disease or are given a vaccine. We're still on a very steep learning curve when it comes to questions of immunity to COVID-19. We aren't even sure whether some or all of us really do become immune after we're infected, or if we do become immune, how long that immunity might last. With other coronaviruses, we develop immunity, but it isn't permanent. So yes, it's possible and even likely that any vaccine against this pathogen will not provide permanent protection from any future infections. But at this point, even if a vaccine provided us with a year or two of immunity, that would be a big win.
Can sunbathing help in coronavirus treatment or prevention?
As spring turns to summer here in the Northern Hemisphere, could increasing radiation from the sun help slow the pandemic? That's a big question. Seasonality is common for many infectious respiratory diseases, although the exact reasons for it are kind of hard to untangle. Experts agree that UV light plays a role, but a range of other factors do as well, including the fact that you're simply less likely to catch COVID-19 outdoors than you are in enclosed rooms. Low vitamin D is another factor that some studies say makes you more likely to catch certain respiratory infections. And your skin produces vitamin D when it's exposed to UV light. So short answer, there's no evidence sunbathing can help treat the disease, but spending reasonable amounts of time sunbathing shouldn't increase your risk of getting it, and it might even lower your risk if your vitamin D levels are low, assuming, of course, that you don't break any lockdown rules and you also pay attention to social distancing measures.